Many children have been returning to school over the last few weeks, and there are still some open questions about just how safe that is and what happens if infections rise over the winter. Well, to talk about that, we're joined by the Chair of Global Public Health at Edinburgh University, Professor Devi Sridhar. Thank you very much for being on the programme this morning. Schools are back. Should we expect to see infection rates rise as a result?
Well, that really comes down to the testing and tracing system and how quickly cases within schools can be identified through having surveillance in place, through having rapid testing in place, and how quickly the tracing teams can ensure that any other children in contact with this child go into isolation and are tested as well. So it's really in our hands. We've seen variable experience in the world from Denmark, which handled school return exceptionally well, has kids back, very little bump in terms of their numbers, compared to Israel, where numbers just skyrocketed because the testing and tracing wasn't in place.
I wonder as well if you could explain a bit of the science to us, because it does feel as if there are lots of conflicting reports out there, conflicting studies about the role that children have in spreading COVID-19. Is there a difference between primary school-aged children and secondary-aged children? What's your understanding?
Yeah, so if we get back just to what we know so far, children can have the virus regardless of their age. They have the same viral load as adults. They can transmit the virus, but for an unconfirmed reason, it seems primary age children transmit less than older children, meaning secondary age. So we have seen, for example, clusters in teenagers occurring, but primary school kids seem to be less affected. And some of the hypotheses are about the social interactions of primary school kids, who they're around. They're around, for example, they're more likely to be asymptomatic, which means coughing and sneezing is less likely, so not infecting others, as well as that primary school kids are shorter, and so they're less likely to kind of be exposing adults or others around them. So there is a difference, but science has not confirmed yet what of those hypotheses it could be.
Fascinating. That could just be down to the height of somebody on whether they are passing it on or not. The government is encouraging us to get back to the office. Lots of people are starting to go back into work now, which of course poses childcare issues for lots of working parents. Is it safe for grandparents to start picking up childcare responsibilities now?
Well, I think the key answer to that depends on what's happening locally, because is it safe enough is really the bar you're trying to pass. If you're on a Scottish island where there's no new cases for weeks, or other parts of southwest of England, then probably you're pretty okay picking up your children, because the likelihood of your child having an infection at school is so low. If you're in a place which is in a local lockdown or has local restrictions in place, or where numbers are increasing, then I would say to be more cautious just for that time until hopefully those numbers come down. And this is why the government really needs to commit to maximum suppression of this virus, because children don't exist in a bubble. All of us interact every day with vulnerable individuals, with elderly individuals. They're a part of our society, and we need to ensure that we suppress the virus so all of us can live together through this crisis.
We'll be talking to Dominic Raab after you, and you're talking there about the government strategy. What do you make of where we are currently when it comes to track and trace, when it comes to what the government's overall strategy is when it comes to COVID-19?
Well, I think on the positive side, what we're seeing across Europe, and this is true whether it's Germany, whether it's now in Britain, Denmark, also, for example, Sweden, is they're moving towards a model of maximum suppression, that if you want to get normality back, if you want the economy to recover, you need to control the virus very tightly. And that's now, I guess, come together, that actually control the virus, you get your better economic recovery. And there, I think the UK is committing. The key element here is getting the testing faster. And this is why I'm a little bit worried about the back to office push alongside the back to school push. So what we've seen in Scotland over the past few weeks is the testing system has just been, really having to race to catch up with the demand of all the children coming home with coughs and colds and fevers. If you add on top of that all the adults going back into offices and having those as well, your testing system's really under strain. So you have to get ready to get your testing system going so that people can get the results fast enough and the tracing teams can get going. That's the main way to suppress this virus and not have to put in place restrictions. When the testing and tracing starts to break down, that's when you need your local restrictions, where you have restrictions on, let's say, going to other people's homes, or on pubs and hospitality, or on riskier settings. So I think that's where we are now. I think we're unlikely to have another national-like lockdown. We've learned a lot about this virus, but it's up to the testing and tracing and each of us and our behaviors to make sure that, we make sure the virus stays suppressed and that we can keep things running as fully, as normally as possible.
Another big question that some are talking about is whether or not there should be testing at airports. It's something that Labour is calling for. We're, of course, seeing increased infection rates on the continent, places like France and Spain. Do you think the government should be looking at testing in airports?
Yes, definitely. I think the UK government as a whole have been behind the curve in terms of border control, one of the latest to put in border restrictions. And when they have been put in place, not really being monitored in terms of compliance with them, and also being quite a harsh measure for the aviation industry, and creating uncertainty. So I think, yes, we definitely need a better approach. The problem with just testing at an airport is that of the incubation period of the virus, meaning people could test negative and then go into pubs and bars and engage fully in their lives and then pass on the virus because they've just been incubating it, in the and symptomatic phase. And so I think what we need to be having is probably testing at airports plus testing maybe 5 to 8 days later. And then at that point, if you have 2 negative tests, and you can get on with your life. But I think testing is really the key to a lot of these issues of escaping lockdown, escaping quarantine, all those restrictions. If you want to lift them, you got to get your testing in place.
We were talking a bit earlier about different risk levels, I guess. So if you're a grandparent, you might be thinking that you can have different interactions based on the infection rates in your local area. And I just wondered, there's so many figures around. What numbers should it be that we're all looking at? Should we be looking at case numbers, hospital admissions, the R rate? What exactly should we trust?
Well, I just look at for different countries when I try to compare them. I look at 3 pieces of data. The first is cases per 100,000, but these, again, are confirmed cases. So if countries are not testing enough, they might have lower numbers. So you also need to look at your testing positivity. That's the number of people testing positive over the total number of people tested. And that'll give you an indication, is enough testing occurring? For example, now in parts of the United States, you're having positivity between 30 to 40%, which is incredibly high. Or in the UK, luckily, it seems to be generally under 2 to 3%. And the third is actually how many cases are tied to clusters. So if I see a spike, but most of them are coming from a factory outbreak that seems like it could be circled, you could do extensive testing, it hasn't spread widely, then I'm less worried. If you're seeing numbers go up and they're all over the country and you're unable to connect them, that tells you you've got substantial community spread, and that's more worrying. So I guess it's those 3 things. It's your cases, it's your positivity, and it's how many are tied to clusters.
OK, thank you so much for talking us through the figures. It's always good to have you on the show. Thank you.
Thank you for having me.